start, Nick, and obviously, thank you. So, good afternoon, everybody, and welcome to this afternoon's webinar. We're really fortunate to have Professor Sarah Connolly come and join us, who is from the University of East Anglia, where they've developed a very useful tool, which is looking at the cost effectiveness of workplace wellbeing interventions. So I had the opportunity to use the tool a bit myself last year. And I did find it a really, it was very nice because it added some sort of sense of robustness to any sort of consideration. So really valuable in what has been potentially a little bit of a wishy-washy, hard to get hold of field where people are putting in all sorts of different ideas and options and possibly being a bit bamboozling to employers. So great to have the evidence and great to have such a practical tool. So thank you very much. I'd just like to give you a little bit more information about Professor Connolly. She's kindly shared a bio, which I will read. So Professor Sarah Connolly is a Professor of Personnel Economics in Norwich Business School at the University of East Anglia. Her research interests are in gender and the labour market. She was part of the ESRC, so that's the European Social Research Council, is that, I think, funded What Works Wellbeing Evidence Programme for work and wellbeing, and a collaboration between the University of East Anglia and RAND Europe, which explored practices and combinations of practices for health and wellbeing at work. This was also funded by the ESRC. She leads the UEA, so University of East Anglia contribution to the Propel Hub, which is a collaboration with 8 universities across the UK with the CIPD, designed to help boost productivity and wellbeing through supporting the growth of better workplaces in the UK. So we've got a very well-versed and experienced person to come and give us some very useful insights today. So thank you very much. And in terms of just questions, if people have got questions as we go along, Professor Connolly has said that she's happy to be interrupted. So what I would request is that if you just raise your hand if we're in the flow, if you wanted to speak, or put a question into the chat box, either way. If it's in the chat box, I'll try and flag it up as we go along. Okay, thank you very much. So over to you, Professor Connolly.
Thanks very much indeed. And hello to everybody. I'm just going to try and share my slides. Do let me know if you can see those.
That's great.
Yeah, we've got
great.
it.
Excellent. Thanks very much indeed. Excellent. My computer's being really slow at the moment, and so I thought we may have to wait a few moments. So thanks very much for the generous introduction and for the interest in the broad body of work that the team at UEA and at RAND have been engaged in. And I'm going to talk about the part that I've really been mostly involved in, which is developing the cost effectiveness calculator. And the talk today is going to both give you a sense of some really quick things that you can do within organizations to begin to think about cost effectiveness. It's going to introduce you to the work that we've actually done in building the calculator, and then I'm also going to show you the calculator itself. And I don't need to repeat all of the different collaborations and the funders. They're on the screen and they've already been given to you. What I would say is that the team that we have been working as part of is a large team. It's an interdisciplinary team. So we've brought together economists like myself, sociologists, psychologists, and people with different kinds of expertise in workplace well-being. And we've undertaken quite a variety of different sorts of research. So we started 7 years ago with systematic reviews and analyses of the evidence. And then we worked on collecting data, undertaking case studies so that we were able to see how organizations implement practices for health and well-being. And then we delivered we developed the toolkit and the calculator that I'm going to be talking about. And just, because it's useful to remind ourselves of the various reasons why workplace well-being is important, that there's certainly a duty of care that employers have to their employees, and compliance with regulation is obviously part of that. There's also a moral case that employers have a responsibility to their employees beyond what's legislated for. And what I'm going to talk about today is actually a business case that actually investing in your employees, in your staff, in their well-being, actually delivers improved productivity, and so that there can be not just breaking even, but actually benefits for the organisation of investing in workplace well-being. And then, there's also a sort of a macroeconomic argument that if at the individual level, if at the organisational level, these investments result in lower rates of absenteeism, then that could mean reduced need on the NHS, and reduced expenditure for the government. And so those are certainly some of the key reasons for thinking about investing in workplace well-being. And our evidence base that we've been able to accumulate identifies a range of ways in which you might improve workplace well-being. And going from the left to the right, you've got some rather easier steps that you can undertake to improve well-being by well-being awareness and promotion, specific interventions that help people if they're struggling. And on the right, what you've got are perhaps the more fundamental things about an organisation and a good place to work, a good job, that is characterised by good relationships, good quality management, and good job design. And so our toolkit, the Evolve toolkit, covers all of these areas. But what I'm going to talk about today is really the things on the left-hand side about well-being awareness and help for employees that might be struggling. And I suppose that over the years, I've become, a really, really strong advocate for all organisations and people at all levels to be thinking about the cost effectiveness of investments in this area, and to think closely about the sorts of costs and benefits that there might be, and to try and measure those. And in classic economic style, we show this with, some scales. Do those costs outweigh those benefits? But if you look at this infographic here, you'll be thinking, well, that's fine. I mean, I understand you might be able to cost up, the provision of an intervention, and you may even be able to cost up the productivity, and you can put pound values to that. It might not be so easy to think about well-being in a monetary term, and that's actually really the fundamental insight from the cost effectiveness analysis, which is that we take these benefits in their own terms. So we accept health benefits as health benefits, well-being benefits as well-being benefits, and we don't try and put a pound value on those. But what we do is to look at the pound value of the costs and productivity, and then we assess whether or not the costs net of the benefits fall within an acceptability threshold. Now, I know that many of the audience today come from healthcare backgrounds, and you're probably thinking, well, that's a bit like a QALY, which is used a lot in making decisions about healthcare. And that's exactly what this cost effectiveness is based on. It's taking the same sort of notion of an improvement in quality of life years, but in well-being terms, that's a unit of well-being sustained over a year, and then looking to see whether the investments fall below an acceptability threshold. Now, actually, when I come to show you this, the results that we have from our calculator, you'll actually see that we get well-being and we get monetary savings too. And so we actually do identify a win-win situation for organizations. So actually those productivity savings do outweigh the costs of provision. And I'm going to, first of all, just talk through how we started the work. And so when we started it, we did it with case studies. We asked organizations, have you tried anything on workplace well-being? And if you have, can we talk to you about the process and what that involved in terms of initiating, training, and what you saw as the benefits? And so these first two examples, and I'm giving these so that you can get a sense of what it's like in an organization. So the first one is in a university, and it was a university with a reasonably large staff in one office. And they were concerned about well-being of their staff because in their annual pulse surveys, they had many of their staff reporting lack of control over their work. And they thought that this wasn't a sign of a good working environment. And so they tried a very, very simple spreadsheet-based flexible working system. And they set out what core hours were, they set out what early start and late finish times would be, and the setup costs were really very, very minor. They were, developing the spreadsheet, developing a system whereby people requested the flexible hours, and then implementing it. And what they found, and here it wasn't a randomized control trial or anything sophisticated like that, it was just a before and after assessment. What they found was a reduction in staff sickness, and that reduction in staff sickness resulted in a really significant savings in terms of days of absence, and that actually delivered a saving overall. And also, and remember, this was one of the reasons that they considered this, they found that staff reported having much more control over their workload. So that's one very, very low key, low cost intervention. The second was a local authority that had a much larger staff, and they had quite high rates of staff sickness, specifically staff sickness due to mental health and stress. And so they experimented with a mental health first aider program, and these are used quite widely. There's quite high setup costs because you have to pay for the trainers. There's also quite a lot of snowballing type of costs as you train within the organization. And what they found was that they actually, with a before and after comparison, found higher rates of staff sickness, but much lower rates of staff turnover. And so what they felt was that by having the mental health first aiders, by training managers in and all line managers in awareness and signposting of support for mental health, although it meant that people did take more days off through mental health, they actually came back to work and stayed with the employer. And so and the managers in that local authority reported increased confidence in managing employees with mental health difficulties. So that was a bit more costly, but again resulted in savings, and the savings here were all about better retention rates. Now, the third case study that we looked at was a much more expensive coaching-based case study. And this was in a construction firm. And this wasn't a before and after comparison. This was a pilot run in a department, and we were able to compare the results for that department with other departments in the same organization. And here the investment was in a really detailed coaching, health and well-being coaching program with intensive meetings, personalized well-being plans, and backed up with resources. And this organization found a big reduction in staff sickness. They found a big reduction in employee turnover. They found really big improvements in the health of their employees. And here, the net cost was a minus £2,600 per person. So these were huge savings within the organisation. This was obviously a much bigger kind of initiative and investment. And I'm presenting these three case studies so that you can get a sense of the different kinds of scales that an intervention might take. You know, some of them really minor, like the flexible working, some much more structural, like this. The different kinds of costs, but also what the organizations themselves felt about the benefits for the organization, and crucially their employees within the organization. So now, you know, I like case studies. I mean, they're always very interesting. And, oh, sorry, yeah.
Might I please ask you whether you examined any confounding factors which might have affected the results, in other words, the productivity results? Because all the criteria you used could or might have been affected by other factors which were operating simultaneously with the measures that were taken.
No, absolutely. And that was really why I wanted to stress that those first two were really just before and after. It's certainly true that there may have been other confounding factors, but for those offices and for those organizations, this was the sort of illustrative evidence. It was a start to collecting data and evidence and an evaluation. This last one is a pilot within the organization. So we're not comparing just before and after in this department. We are comparing before and after for this department against the rest of the organization. And so we could be more confident that any other organizational factors, or even any sort of economic kind of factors, would have been common across those groups. But these I'm not presenting as the sort of the robust evidence base that you might get from a randomized control trial. I can and I can certainly point you in the direction of that. I'm giving these just so that you can see that it doesn't need to be a really big thing to make a difference within an organization.
Oh, you're muted, Sarah.
Thank you. I also wanted to stress that in organizations, it's really important to be thinking about just the very basics of evaluation. And this slide is really a sort of a prompt on the kinds of questions that could be used to try and identify the different levels of costs, the scale of uptake within the organization, but also the benefits that might arise in terms of improved or reduced absenteeism, reduced presenteeism, and better staff engagement. And on the What Works Centre for Wellbeing, what we have is a spreadsheet which is downloadable that organisations or researchers can download, and it has a sort of a detailed how-to and prompts on the spreadsheet macro to help you implement and evaluate wellbeing initiatives. And so that's a kind of a background on where our work started, and we started with working with organisations. But I mean, partly because of exactly the point that Theodoros asked in terms of, you know, the confounders, but also because of scale. I mean, you can't talk to thousands of businesses about these things. And so what we wanted to do was to use a large scale secondary data source to help build a business case calculator. And so these are the links to the business calculator, and I'll take you through the example a bit later. And so the calculator gives you a choice of different kinds of workplace health and wellbeing initiatives. It measures 3 different types of wellbeing benefits: physical health, mental health, and job satisfaction. It looks at the possible benefits in terms of improved productivity using 2 measures: absenteeism, which are days lost, and presenteeism, which are when people are at work, but they're working at less than full capacity, and so their productivity is diminished. And the calculator gives you some indicative costs of the interventions, and it also, and this was one of the things that a lot of employers asked us about, was, I provide these things, but no one seems to use them. Does that matter? And so one of the things that we're going to do is to also look at use and awareness of the interventions. Okay. So the data comes from Britain's Healthiest Workplace data. It's incredibly rich, large scale, lots of organisations of different sizes in different sectors, lots of people working within those organisations, and they provide lots of information on their own health and wellbeing context, but also on the work that they do and an organisational context. And across the companies that participate in Britain's Healthiest Workplace, there are hundreds of different kinds of initiatives that they ask employees questions about. They ask them, first of all, are you aware that your organisation runs this? Have you used it? And if so, did you feel better? And we use the first of those 2 to get a sense of whether people are aware of an initiative but don't use it, or they're aware of an initiative and do use it. And what we're interested in is whether or not there could be any benefits just by people being aware of the provision of these kinds of opportunities within their organisation. Obviously, we couldn't look at 100 different sorts of interventions, so we refined them into similar sorts of activities. So the things on smoking and drinking we put together, where organisations had either gym memberships or cycle to work schemes, we put those together, and you'll see on the right hand side the way in which we put things together. And some of these interventions were only very recent. Others have been available for a good number of years. And so this is the summary of the different types of interventions. And you can see from these figures that there's quite a big difference between, awareness and use of, for instance, the stop smoking or drink less types of intervention, and the healthy eating or the weight management interventions. And so clearly, you're not going to get 100% using everything, because these are things that may not be of an issue to some people. And so that was really another reason for thinking about separating out the knowing about the interventions and the use of the interventions. And we're imagining that things like the well-being, the financial well-being interventions and volunteering, these were relatively newer interventions, and certainly with the cost of living crisis, these kinds of financial well-being interventions likely to be much more important going forward. And so our model, and I'm going to skim over this because I know not everybody will want to know all of the details, but they are there in the slides if you are interested and would like to look at it in more detail. So I mentioned the 3 measures of well-being. The productivity is asking people about the last 7 days, and asking them about the number of hours that they missed from work because they were ill, or the number of times that they felt that their productivity was impacted at work. And then we aggregate these into a percentage of time not lost through absenteeism. So what we wanted was an improvement, having a positive number. And this really does come back to the point about what else could be affecting people's health and well-being. Well, it could be something about themselves. It could be something about the job they do. It could be something about the organizations in which they work. And so we control for all of those things. And what we do in terms of the modeling is a 2-period structural equation model. So we look at when people use the intervention, we look at what happens to these 3 measures of well-being, and then we look at what happens to their productivity, both directly from using the intervention and indirectly through improved well-being. And we're using a lag-dependent variable model. So what we want to do is to take account of pre-existing levels of well-being and pre-existing levels of presenteeism. So what we're able to isolate are the improvements that are associated with engagement in with the intervention. Now, in terms of the main results, I think that the key result in terms of well-being is that people that were already had quite high levels of job satisfaction, good health, good physical and mental health, generally had higher levels of well-being in the second period. What we also find is that both knowledge and use of these interventions is always associated with higher job satisfaction. And so what we're able to say is that controlling for the individual characteristics, controlling for the workplace, controlling for their pre-existing levels of well-being, we identify improvements in well-being specifically through improved job satisfaction. And the results are here on the well-being, and so you can see that absolutely, regardless of which type of intervention we're talking about, those people who had better well-being before continue to have better well-being in the following period, but also these very, very strong results around awareness and well-being and use and well-being. The second set of results relate to productivity. And again, those people who had less absenteeism and less presenteeism in time one also had lower absenteeism and lower presenteeism in time two. But we also see that those people who have higher levels of well-being have higher levels of productivity. And so here are the results relating to the links with well-being and productivity. So you can see here the link with your prior levels of productivity and your current levels of productivity. So productivity is higher if it was higher in the previous period, but also these very strong results across all of these different types of intervention between well-being and productivity. And the last key result is that awareness and use of the health and well-being initiatives is associated with improved productivity, and it is not a direct effect, it's an indirect effect via improved well-being. And so here are the results here, very strong indirect results between use of these interventions and or knowledge of these interventions and improved productivity. So we have these results based on thousands of people, hundreds of organizations. And what we then wanted to do was to put this into a monetary cost and benefits approach, because we know that both the provision of an intervention costs an employer, and we know that absenteeism and presenteeism cost an employer. We put a pound value for each of these. And what you can see here is what are our overarching results about these interventions. We can see very strong impacts of these interventions on job satisfaction, rather smaller impacts on mental health and physical health. We can see some very big effects, particularly on absenteeism, so improvements in productivity associated with these interventions. And then we can see the sorts of savings that arise because of these improvements in productivity, and we can see these savings usually exceed the costs of the interventions themselves. And that is the sort of the fundamental of the business case that we're making. So I appreciate not everybody is going to be looking at the paper and looking at the results. They're much more likely to look at a website and see what these results might translate to within their organization. So I'm just going to show you a few screenshots of the business case calculator. So the first thing is, because we've got 10 different kinds of interventions, you can pick your intervention. What is it that you think your organization might be interested in engaging in? And because these costs and benefits depend on the salaries within your organization, we have an average salary band that you can choose. You can leave it at the national average if you don't know. So that's the data that you're asked to provide. And then and this is for physical fitness, what the physical fitness average values are. This type of initiative has a 6% improvement in job satisfaction and around 1% in mental health and just over 1% in physical health. The savings that you might get would be about £750 per worker through reduced absenteeism. And the estimated annual costs of the initiative per worker around £46. So you can see that the benefits are actual savings in addition to those improved well-being figures. And then the website gives you some illustrations of the types of interventions that would fall under that broad category. The other thing that the website allows you to do is to take advantage of the fact that we've separately modelled the impact of knowing about the intervention and not using it, and knowing about the intervention and using it. And so what we offer the user is, well, on average, about 77% of employees within an organisation will know that they provide physical fitness facilities, and about 36% of them use it. What would happen if you actually change the level of awareness? And so this is something, of course, an organisation has the possibility to do, make sure that through communication that people are aware of the facilities, and you can see what would happen to your costs and to your savings associated with improving awareness. And so I've illustrated this here, and you can see that actually if you improved awareness of the physical fitness, you'd actually be able to deliver even greater improvements in well-being and in overall savings for the organisation. And that's partly driven by people using it, but it's also because people are aware of this as an organisational provision, and that makes them feel as though they have a caring employer in an organisation that treats employee well-being seriously. So what would I say that our main takeaways are? I think that we have evidence that the interventions not only improve well-being, but can also deliver good financial returns. The model itself only considered improvements in absenteeism and presenteeism, but because a lot of the improvements arise around improved job satisfaction, we know that there will be even greater savings because those improvements in job satisfaction will also be associated with improved staff retention. And staff retention is a huge loss of productivity, or well, losing staff is a huge loss of productivity for organisations. And so the main message is that looking after workplace well-being isn't just a cost, it's an investment, can deliver improvements to the organisation. And also you shouldn't, as an employer, be too concerned about use of the interventions, because what we're able to identify here is that there are positive effects associated with both use and associated with just being aware and knowing that that sort of help is available should you need it. And then lastly, I mean, these estimates are all based on the average organisation, and that it's not enough to just provide interventions. There's obviously something about the cultures within organisations, support from managers, which also matter. And Kevin Daniels, who's the lead on our project, is a keen gardener, and he says, it's not just about planting the seeds in the soil, you've got to look after things properly too. And so a lot of what our toolkit does is to talk about what you can do to improve the well-being culture within your organization. So, and that will be about how you provide these things, how you communicate them, and also whether or not that offer is seen as authentic. That well-being. So thank you very much. any questions?
Great, thank you so much. That was fascinating to listen to. So thank you, Sarah. A brilliant presentation. Really lovely to sit back and hear the research story from, you know, creating the tool. So that's a real pleasure to hear, and really quite astounding to see those numbers as well. So, you know, quite enormous impacts actually, which I have to say, having been involved in the work of workplace wellbeing for some time a few years back, actually that really was the holy grail, was to actually find and demonstrate impact. So it was brilliant to see those numbers. I'm going to jump in with a couple of questions. And by the way, I do realise that I did the same thing that I always do, which is forgetting to introduce myself. So I'm not sure whether to bother now, but there we go. I'm an occupational health doctor with RPS, so partly based in London, partly in Somerset, and had been involved in workplace wellbeing in the past and had written a couple of papers, one actually co-authored with Professor Daniels from your team. So that was interesting. So my questions were, I mean, to start with, I thought the construction company case study was really very interesting indeed. And I was wondering, because it seemed so unusual that a construction company would take that coaching approach, to be so bothered and to invest so much, which really flagged up for me a question about what motivated them, if you did know that. And I was also curious to know about the sustainability and sort of what they did to embed any of those changes, if you were aware of that story going forward.
Yeah, no, that's a really good question, because I think that it really gets to the heart of how an organization might go about you know, embedding health and well-being in all that they do. And I think that what we would say is that they used a lot of the lessons that they'd learned from health and safety, so that in construction industries, in oil and gas, in industries where, you know, that there are serious health and safety considerations, they have worked very, very hard at improving their safety climate. And what this particular organization was convinced of was that it was a useful approach to take in embedding concerns about health and well-being. And the reason that they were concerned about it is that in construction work, teams are often away from home for long periods of time. They're mixing very, very physical work with often poor diets, and there is a problem of loneliness, and there are very high suicide rates in the construction industry. And so those two things, the concern about their workforce, but also the lessons learned that you don't do health and safety with a tick box exercise, and so you wouldn't do health and well-being with a you know, here are all of the things, just get on with it kind of approach. And so they did embed it in absolutely everything that they did. And so it was an important part of their appraisals for individuals, for managers, and they resourced it seriously. And you know, they won awards for being you know, a good employer in this sector, and that had other business benefits for them. You know, that this is, you know, the business case might be that you make savings today, but actually if you also enhance your brand, if you become an employer of choice within a competitive business, then that's helpful for recruitment as well as retention.
Brilliant, thank you very much. I'm not going to hog things too much, but I am going to ask two more questions. So the second question really related to the Britain's Healthiest Workplace data set that fed into the model. And I suppose I'm wondering how long that data set, what's the duration of the data set, and also something like, you know, in response rates, and which organisations are actually feeding into that, whether there's a sort of selection bias or response bias in that.
Yeah, so the first Britain's Healthiest Workplace survey was in 2014, and it was annual until 2019, when, of course, everything was disrupted by COVID, and it simply wasn't possible to get the business engagement and response rates to that. They have collected another wave of data, so at least we will have a sort of a before and after comparison. What I needed was to have the same person in consecutive surveys, and so I had started with a requirement of 3 consecutive surveys. So I wanted to know about what happened, what was the pre-existing levels of well-being and productivity, what happened to well-being, and then in a third period, how did that feed through into productivity. That meant I was only able to really look at a smaller number of the initiatives that had been where I had data from 2014 through to 2019 at least three times, and so that's why I went to a 2-period model where I just looked at the pre-existing levels and modeled simultaneously the impact on well-being and productivity. The results were actually very, very similar, so I don't feel that was a restriction. In terms of the response rates, this is not a random sample of organizations. Organizations have to want to participate, and the organizations do come from different sectors, so there are across from manufacturing, construction, service sectors, public sector, so there's a sort of a reasonable coverage of different sectors, and I think that when we were first offered the opportunity to look at the data, we really thought that it was the sort of survey that organisations that were super confident about their well-being provision would engage in. But actually, there are plenty of organisations in there that have really poor practices and really low levels of staff health and well-being. And so what we realised is that, yes, there may have been some people that wanted to win the prizes, but there were also lots of organisations that were using the participation to try and up their game and improve their provision. And then there were others that simply wanted to benchmark. And so I think there were different kinds of motivations from the organisations in terms of participating. And so as a consequence, I'm not really sure that bias would go one way or another. And the other thing is that I did also think it might be dominated by large organisations, but there are also quite a number of small organisations, with not as high as there exist in across the UK economy. But it's I can't say it's representative, but what it does is it gives us the data in a really granular way that helps us explore these topics, and also helps us then make the case to the funders of the big social studies data sets to start asking some of these questions, so that these topics can be explored more extensively.
Thank you. Okay, great. And my third question, and then I will pass on. Sorry, I know that I won't grab it back again otherwise, but then I will be very generous in a moment. So the final question, this relates a little bit, well, it's a softer question, this one really, because it's so interesting about this increasing awareness having impact. And I'd just be curious to know what sorts of hypotheses you might have about why that is the case.
Yeah, I think that it is really around this culture of authenticity. It's also around a sense that that beyond the employment contract, there's a psychological contract, and these kinds of provisions boost feelings of loyalty and engagement within the organization. So I think it's that, and I think also that there are there are some types of interventions like the addiction ones, like the financial well-being ones, that people, that the rate of take up is always going to be relatively small, but people do feel that this is stuff that should be offered within that broad portfolio of health and well-being initiatives. So I think that that's the sort of route by which we see those benefits.
Yeah, thank you. So psychological contract, that's very interesting. Thank you very much. Right, we have 2 questions from the audience, and I know Theodorus has been putting his hand up very clearly. So Theodorus, over to you.
First of all, I would like to congratulate you most cordially for a brilliant study and most comprehensive, excellent presentation of the study. And if I may say, this issue of cost effectiveness related to occupational health is something that has been of a great concern to me for many years. And as far as I know, in the UK or in Europe in general, there hasn't been any such study which is so specific and encompasses so many sectors and types of work. Now, I have a few questions. I will start by examined well-being and not health might make a difference insofar as it may make this study not duplicable in another country. I'm thinking of the European environment. This is why I ask this question, because the definition of health itself includes well-being. The second question is whether this study is going to be published so that one can study it and possibly also present parts of it or arguments coming out of it to employers themselves more widely than individual occupational physicians can do. Secondly, I would like to ask you whether the prize that you mentioned was received by the companies which won it, or whether the workers themselves had any other benefits apart from the moral reward. Thirdly, I would like to ask whether the hundreds of companies, the data, the secondary data came from Britain Health Workplace data, had a distribution which might be similar to the distribution of the size of companies in the UK. And I'm asking this question not only in regard to the UK, but also in regard to other European countries, including Greece, where I'm based at present, even though I'm fully licensed on a consultant status to work in the UK, because if this distribution is not the same as that of the distribution of companies in the UK, this might be an issue that many employers may actually argue against if I present them the results of this study. Another question is whether you mentioned you examined the average salary. The word average is something that employers consider very carefully and more often than not are not willing to accept. And therefore, of course, I think that the personalized study that you have embarked on is most important. Now,
Theodorus, can I just jump in a minute very quickly?
Yes, of course. So I think these were all my questions. And if this study is going to be published, I'll be very glad to receive some information as to where it has been studied. And also, I would like to ask you whether you and your team might be interested in duplicating this study in another country, for example, Greece.
That's great. I'm just going to jump in really quickly just because of time. I don't want to hold Sarah up beyond her time. And we've got another question from another member of the audience. So just to throw that into the mix. Have you got capacity to stay on a little bit longer at all, Sarah?
Yes, no, I can. I mean, let me just very quickly answer those questions. We looked at the measures on job satisfaction, on health, and on mental health, and on physical health. So we had 3 measures of well-being, and so I think that a more health-based measure would probably align quite nicely. We certainly do hope to have the work published, and I will very happily let people know of those details. But you can certainly see some of the workings in the website with some of the explanations of our measures and sources of our measures. The prizes to the organization, these were not financial prizes, they were really sort of publicity prizes, and yes, they were at the organizational level. The size of the companies, I think this is a big issue, that we were underrepresenting very small companies and micro businesses, but our case studies that we have also made available on the website, and I'll paste the details in the chat. That has details, longitudinal details on, I think, 4 companies with less than 10 employees, and so I think that gives a sort of a broader evidence base on the companies. And the average salaries were just used for, thank you very much, the average salaries were just used for illustration purposes here, and you're absolutely right that an individual organization can use their own salary detail to make an evaluation or an estimation of what the benefits and costs would be for them. Thank you.
Which company would that be? Sorry, which website would the information be on?
Oh,
so Jennifer has just put it in the chat.
Yeah, thank you. Are you happy for me to move to the other question we have from someone else? Have we covered yours, Theodorus?
Thank you very much.
Okay, wonderful. That's great. Sounds like there's an ongoing conversation to be had there. So the question we have from Molly Healy is there anything similar which looks at an occupational health absent management service?
Well, actually, I know of 3 really good studies that do cost effectiveness analysis of occupational health. So I'll also put those in the chat too. Because that's obviously going to be a more specific interest to this audience.
Wonderful. Thank you very much indeed. That is great. Now, we are...
And sorry, I realised I didn't answer Theodorus's last question, which was, right, if anyone has any data and they'd like an analysis, I'm very happy to explore collaboration. So thank you very much. Yes.
Thank you. I'll ask for your the society for your email address, if I may have it. The contact details. Thank you very much.
Sarah, you might be heading over to Athens before too long then, by the looks of it. So that sounds like a good outcome. So we're at time. Thank you so much for an excellent talk. Thank you so much for handling our questions so well, giving us such interesting background to the whole study. It sounds as though for all of us, or many of us, we could have stayed for hours. So maybe we'll be all emailing you fervently this evening. But thank you very much. It was great. Really good to know about the work, and really great to know about the calculator. So thanks very much. And thanks everyone for the questions and attendance.